Hi everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. For this video I want to talk about stairs, particularly going up and down stairs after knee replacement surgery, as well as using stair training as a strengthening exercise after surgery. So here's our stairs, and this chair is kind of acting as my railing. So when you go up and down stairs after surgery, what you want to think of is the phrase up with the good and down with the bad. So what that means is when you go up the stairs, you want to lead with the good, or the sound leg, or the leg you haven't had surgery on. And when you go down the stairs, you want to lead with the bad leg, or lead with the surgical leg. So for example, if I had surgery on my left leg, when I go up the stairs, I want to go up with the good, so I'm going to lead with my right leg and come up. Now when I go down the stairs, I want to lead with the bad, so lead with the surgical leg. So I'm going to lead with the left and then come back down. Now, if you had bilateral knee replacements, what you want to do is basically figure out which leg is a little bit stronger and you feel a little more stable on. Typically this will be your dominant leg. So for a lot of people, your dominant leg is going to be the same as whatever hand you are. So for a lot of you, it's going to be your right leg. So if you had bilateral replacement, up with the good, you want to lead with the right, and down with the bad, you're going to lead with your left going down. However, you might notice that one leg is a little bit stronger than the other, or a little bit less painful, or better able to tolerate different activities. So go ahead and use that one as the sound leg, and the other one as your quote-unquote bad leg. Now I also like using stairs as a strengthening exercise. And when you use stairs for strengthening, the rule of up with the good and down with the bad actually doesn't really matter. Because what you're going to do is, when you go up and lead with the surgical leg, now you're going to start to strengthen that leg. You're going to have to push up your body weight to get up onto the step, and that's going to strengthen the quadricep muscles of your thigh. It's going to strengthen your glutes and all the muscles that extend your hips. So when you do strengthening exercises, you actually want to do repetitions leading with the surgical leg. And then I'll also have my patients do repetitions leading with the non-surgical leg, because we want to maintain good strength in that leg as well. A couple of things to keep in mind when you do step-ups for strengthening. You want to focus on having, just like with a squat or a lunge, make sure your knee is coming right over your foot. You don't want it caving out to the side or caving in like this. You also want to keep a nice upright trunk. Try not to bend forward too much or tilt to the side. And the other thing is, when you step up, make sure you get your whole foot up onto the step. Sometimes people will put just part of their foot on the step, and they'll come to step and they'll lose their body weight, lose their balance backward. So put the whole foot up on the step, come right up, and then you can either come back down behind you or you can step forward. Also, if you have some difficulty doing a step up just with your body weight without holding on to something, use the railings. You can use one railing or two railings. Typically, most physical therapy clinics will have railings on both sides. So use the railings initially till you get comfortable and get stronger. There's nothing wrong with that as well. So just to summarize, when doing stairs at home or in your day-to-day life, you want to focus on going up with the good and down with the bad. So that's up with the non-surgical leg and then down with the surgical leg. When you're using this step up as a strengthening exercise, be sure you're doing a couple sets leading with both legs so you can build that strength back up and better be able to tolerate steps and other functional activities in your day-to-day life. Thank you very much for watching, everyone. Have a great rest of your day.